Yeah, perfect.
Love that t-shirt.
Thank you.
Yes.
It's really supposed to be after the hospital.
Oh, yeah, you wore it today?
Yeah, because I need like shorts.
Oh, you're gonna go edit it later?
Yeah.
Okay.
Well, I really don't have to because look, you can see. I know what I'm doing, girl.
Is it ready?
Yeah.
Good morning, Miss Lily.
Good morning.
How are you feeling today?
Um, so.
So, what's going on? Are you having pain?
No.
Okay.
Let me turn this off. So no pains or anything. I think I took my medicine too late, so I feel kind of dizzy. But they're cooking right now, so.
So you're pre-medicated with Benadryl so that you don't have...
No, I
No?
didn't. Let me go get it. Only because how I was feeling, but
Your bedroom looks beautiful. I had
thank you. You forgot
Yeah, I
how
had
it
not
looks?
seen it since you put the picture up, the bed there. Um,
Okay. I was gonna say, where did they put the Benadryl? Okay.
your clock is so cool.
Thank you. Benadryl.
Benadryl.
Why am I taking Benadryl?
Yes, pre-medicated with Benadryl so that you don't have a reaction to the medication. And this is ordered by your doctor to pre-medicate with Benadryl.
Yes.
It's not something you just chose to do. It's something your doctor ordered you to do prior to your injections. The first thing we will do is to listen to the baby's heartbeat.
Oh my God, I do not want to take this.
You want to take half?
See, I'm gonna take half of it. Probably not even half. Probably like just a little chip off of it. I can't open it now.
You're going to be editing, correct?
Yeah, I can edit it.
Well,
Because what I can do is just like screen, record, and edit out what I want to edit
we don't want to show us 20 minutes trying to open a Benadryl.
out.
That will be very boring to your viewers. They will lose interest. They'll never get to the rest of it.
But I got one more left.
Yeah.
But I just had a little chip. It fell somewhere. I got it.
Oh.
Yeah. Because that's what I was looking for. I'm like, I had a little chip. It's my
When you
stomach.
say chip, let me see.
I'm going to bite a little piece off of this. I don't want the whole
You
thing.
need a drink. Do you have a drink in here?
Yeah. I got soda over there.
Nothing in here. Right.
Yes.
No caffeine. You
I
feeling
really
any
do.
tightness? Or is this just stretching?
Baby moving right now.
Yeah. Right there. Your fundus, your uterus feels nice and soft. Just baby kind of stretching out. You better edit this.
It's so hard.
All right, Miss Lily, tell us what is so hard.
Pregnancy.
The last part of the pregnancy.
The beginning, the end, or the beginning, the middle, and the end.
Oh,
It's really hard for me.
see. So how are you feeling today? We're going back to that question.
I feel like I need to eat. I did eat something. I ate some beans just to kind of bring my sugar up a little bit. Because when I took my medication, like, I felt like this dip. So I laid down and I had my daughter go and warm me up my beans. And they're cooking right now.
Oh, wow.
So I could eat. Because
What
I
kind of
don't know.
beans?
Pork and beans.
Nice.
Yeah. It was just like a little small portion of it, but just something to help me.
Just put in your tummy.
Yeah.
All right, let's find this gorgeous baby.
Trying to move back from you.
Sounds beautiful. Sounds strong.
Got me out here dancing.
140.
Okay.
Perfect. Did you have a doctor's visit this past week?
I go tomorrow.
Tomorrow.
I go for the weekly
You're going
non-stress
for
test.
a weekly monitoring session, a non-stress test. Put your belt and listen to the baby, and then a belt to check your contractions. Are you experiencing any contractions?
Right now? No.
How about in the last 24 hours?
Yeah. Today I had maybe like 6 of them. It's about 6 good ones.
And your doctor's aware because you told your doctor last week, and they checked you.
Yeah.
They checked your cervix. What did they find your cervix to be?
It was 1 centimeter and soft.
One
That was Thursday.
Thursday.
But I don't think, I mean, there was some more changes on, let me calm down so I can do this.
You're calm. So, we also have a history of high blood pressure. Definitely important to check your blood pressure when I see you. Nice breaths in and out. Over the easy.
highest been.
It is the highest number we've had, yeah. It's still within parameters.
That is, I don't like that.
Neither. Move forward and then we'll listen to your runs on the back. Right. You've been healthy during your pregnancy. That's good.
Mm-hmm.
And a couple visits to the ER.
Mm-hmm. I think only like 3.
Just breathe normal. Let me listen to your heart. Constipated.
Again. Can you hear anything in there?
Partly.
It's ready to come out. Well, I haven't been taking the laxative, but I could take it or whatever. Last week I did really good though.
Yeah.
Okay.
Just gonna check your reflexes.
Kinda heavy.
You don't look swollen at all.
Yeah, I really haven't had any swelling. Just if my feet are dangling too long, that's it. Yeah, or if I'm standing too long, the gravity. That's all. Can you explain why am I taking these progesterone injections?
Yeah, so you have a history already of having delivered early, preterm labor. And some women are found to deliver early because of the low level of progesterone. Progesterone actually helps you maintain your pregnancy. So your doctor chose to order the progesterone to give you a better chance and the baby a better chance to stay in the uterus. The main effect of the progesterone, one of the main effects is to relax your uterus, decreasing irritability and decreasing contractions.
Very hard.
And you have been very brave
Yeah.
and taken a lot of injections.
Yes. Because they hurt,
They hurt.
but not that bad. With you, they don't hurt that bad.
And you have made a huge sacrifice in taking an injection every week so that you can give your baby the best chance it can to make it as long as possible in your pregnancy. Yeah, you've been successful at that.
Yep.
I'm very proud of you.
Thank you.
Yes, it is hard being pregnant,
Yeah.
especially towards the end,
Yes.
because that's when more things can kind of come up. Like your blood pressure could become more elevated, 36, 37, 38 weeks. You could have more contractions, you could start to dilate. So, yeah, you're 35 weeks. Excellent.
I want you to check my blood pressure again later.
Okay.
Okay. I am so not pleased with that number. I'm not.
Well, you are pretty excited to have me here, to be
Yes.
recording, and it's your last
Finally,
injection. So
because remember we were
there's-
gonna do it every week, every day.
Yes, so it's all coming together for you. Which, and that blood pressure can just be from your excitement and your anticipation
Yeah.
of your last injection. Because you take
That's
your
if
medicine.
I let it be my last injection.
If you let it be your
Because
last
she did say I can go to 37 weeks, which next week I cannot believe I'm gonna be 37 weeks next week, a full term baby.
It's going to be different.
Oh my gosh.
So let me ask you, you said yes, baby movement throughout the day.
Yes.
How about headaches?
No.
Because headaches are can be one of the first symptoms of blood pressure elevation.
Okay.
So you mentioned for that. Any vaginal bleeding,
No.
leaking of fluid? Okay, great. Let's get you ready for your injection. Any itching with your last injection?
No,
Good.
I didn't.
Good.
I don't want it on this side.
You can choose Which side do you want me to give it on?
Okay.
Today.
Okay. Because I'm like, I don't know if I want to irritate this side again.
Now that it's feeling better.
Yes. But I'm going to tell you what I've been noticing since this side started feeling better. I started noticing, because when I was 9 months pregnant with my other baby, the 8-year-old, I hurt my legs in between here. So I've been noticing that the ligaments between my legs have been hurting again. First started out with this side. It lasted for about
Let's have you extend your legs up.
4.
So is right what feels like in your groin right here?
No, right
There's
in
more
here.
here.
The
Okay.
part
thigh,
where,
inner thigh.
yes, but where it connects from your there to there. I tore those ligaments, and I noticed like the last pregnancy and then this pregnancy, it was like re-injured just from me getting up and down, going to the restroom, or even just sitting on the toilet too long. And it's like, oh my gosh. So now it's like when I use the restroom, I'm having a contraction now, I have to squat. You feel that? It's growing. Yeah, I can feel it growing. It's gonna really
Building up.
Yeah. I am so scared to go in labor at home.
Are you feeling any pain with this contraction?
I do. All of them now.
Okay.
And
Oh,
it's
yeah.
right in here.
It's strong.
Yeah.
It's strong. This contraction is strong.
I have them like this it's all in here.
On your back? Both sides?
Yes. No, just this
Just
side.
the right side?
Mm-hmm.
Starting to go away.
It's going away now. But yeah, I have them all the time. And I'm like, what if this is it? What if this is the kickstart?
Is that what happened last, you say, with your 8-year-old? You started to feel...
Yeah, yeah. Well, it wasn't the 8-year-old.
Oh, yeah, no, because you came to...
Yeah, I had started the progesterone with the one before her. So, let's show them that needle. Can they see it? They could probably see it. Hold on, let me get my glasses.
Perfect. Let's stop waving this needle around. That put it where it belongs.
Oh my gosh. Here we are. Is this not good?
Are you able to bring this leg over more?
Oh gosh. Let's see. Should I try to put my legs over here?
Yeah, there you go. There you go. So much more better.
Oh my gosh.
Are you able to lean forward a little bit?
This stomach is in the way.
Okay, that's good.
I'm gonna have to lay in the bed or something.
So tell us, you're going to breastfeed or what?
Breastfeed.
You ready? I'm ready. 1, 2, 3. And you're going to need a pump.
I have pumps.
Good.
I have 2.
How did you acquire the pumps?
How did I require them?
Acquire them. How did you
Acquire?
get them?
Family members.
Oh, nice. How you doing?
Good.
Wonderful. Now, would you recommend this treatment to someone
others?
else that was worried about delivering early and had a history of preterm labor and delivery?
Mm-hmm. I actually recommended it to someone else, but they were very much so uneducated. So they pretty much went by the doctor's orders themselves, although they had 2 babies that passed at like 21 and 22 weeks. and they still didn't like really buy into what I was telling them with their last baby, and they ended up having their baby on. That was my acid reflux, just from me getting like that.
Acid reflux.
Yeah, we'll talk
From the
about that next.
pregnancy.
So they had their baby right at 24 weeks, and I was like, "Told you, get on some the progesterone, the shots and stuff. It really helps." I mean, I thank God I've never had babies that soon. That mine were late, premature babies, very close to full term.
Yeah.
So I was really lucky for that. You gonna do my blood pressure again?
Unless you want me to.
I want you to.
Okay, remember how you were sitting for your injection?
Yeah.
How about if you sit that way, facing that way?
This way?
Just a little bit
I think it's still gonna be up.
more. What?
I think it's still gonna be up. So still not that relaxed. I told you. I mean, at least it's not like high.
No, it's not. That's within
Yeah.
Remember
I'm
that.
just so used to it being so
I know,
low.
yeah.
So,
But you can not.
But-
Number one, you can have a rise in your blood pressure towards the end of the third trimester. So
right.
you were there. So it could just be a slight increase. If it starts to go up, then your doctor should be concerned about it, and they will be. And they can do a urine protein test. Remember those? Collect your urine in a bucket, and then take it. And they can do some lab values on it. So the things that you want to remember: any headache, heartburn that doesn't want to go away after you're treated.
That's probably what's making it go up because I'm so
You're
irritated by it.
so uncomfortable.
Yeah, the uncomfortableness could be making that happen as well because I'm just like so over it.
So I know you're very good about listening to your body and acting appropriately. So tell me, under what circumstances would you now go to the emergency room or to the labor and delivery triage to be evaluated? Tell me the circumstances.
I think for me, for the pregnancy, if I'm feeling really dizzy a lot, if I'm having leakage, if I am having bleeding, if I am having headaches that will not go away, and I know I haven't been having headaches, if I am having contractions more than, or like 6 within an hour, right?
It's more than 4, but yeah.
More than 4,
So,
exactly.
5, 6,
That's what I know. I know it. I know it.
You do, you know.
So 4, I don't know, with blackouts or.
I mean, every time, if you ever fall, you need to go to triage. You need to report the fall to your doctor, and then you need to go to triage to be evaluated. If you don't feel the baby move as much.
Oh yeah. So every hour I'm supposed to do the kick counts.
No.
When do I
You
do
can
it?
do kick counts twice a day, once or twice a day. And you know how to do the kick counts or the fetal movement counts?
Not
Like
really.
always. So if anytime
I mean,
you're
because I guess
concerned-
because I kind of know the baby's pattern a little bit. But
Yes. Every woman gets to know the pattern of the baby's awake and sleep cycles. So you would kind of look out for that. If you wanted to do a fetal movement count, then you would start everything always with drinking a big glass of water, emptying your bladder, and then laying on your left side. You're going to take your right hand and put it on your tummy. You're going to look at your clock or your cell phone, set your time. and you're going to count 10 movements in an hour. So if you have 10 movements in in 1 hour, you're done with your kick count, and the kick count is reassuring to you.
Okay.
You feel baby movement, or 10 kicks or more in an hour. If by the end of the hour you do not feel 10 kick counts, then you can go to 2 hours, and it must be within those 2 hours. If you don't feel it 10 or more in 2 hours, then you call the doctor and you go in and let them put you on the belts, and then they'll really be able to see the baby's heart.
Okay, so what if you have a fetal Doppler that tracks the baby's heart rate, but you're not feeling the kick counts? What do you do in a situation like that?
You still need to go, yeah.
You still go
If
to
you're
the
not
hospital.
feeling the movement, but you're hearing the heartbeat,
Uh-huh.
yeah, I would still go. I would
Okay.
still call and let your doctor know right away. Yeah.
Okay.
Yes, ma'am. Good job. So you picked out a name. Share with everyone, baby's name. Are you ready to share?
I'm not ready to share the baby's name.
Oh boy.
The baby's name is still a secret.
Oh,
Tip top secret.
Does anyone know?
No one knows
Oh,
the
I
baby's
love it.
name except for
Oh.
me.
How exciting.
But the thing is, I have a couple of names, but I want to see how he looks 1st. Because remember, he's so far down that I don't even know what his face looks like. I hope he's not ugly. He needs to be handsome and cute, and he needs to have good hair.
See,
I don't want a nappy.
These are the things.
I don't want a nappy-headed baby
That's,
where the hair is just like I can't even. If I comb the hair, the baby's gonna be crying, and I'm hurting the baby. I don't want to hurt my baby, so that's why. And then if the baby is too young, you can't get the baby a haircut. So hopefully the baby will have manageable hair where I'm not combing it and he's crying, and I don't want to go through that with my baby. Now when he turns about a year or so, and if it, because in afro hair it changes as the baby gets older, and the hair gets coarser or more coarse. So that's why you see like a lot of Afro-American babies, when they're a little bit older, they have haircuts like all the way down, because the hair is more manageable and it looks more presentable, neater, you know what I'm saying? It looks more clean cut. So
and then when they get older, like 15 or 16, then what?
then they do whatever they want to do with their hair. They can braid it, they can grow it out, they can dread it, they can do whatever they want to do with their hair then, because I don't have to deal with it. By that time, it's all personal choice, personal image of how they want to look or feel, like, you know what I'm saying? So
Yes,
yeah.
ma'am. Good. I like that answer.
Yeah.
Yes. Any concerns that you have right now?
No, besides I need to eat some food. And I'm sleepy now because Benadryl is starting to kick in.
Feed me.
Yes. What else?
So far, what has been the most challenging part of your pregnancy?
The irritable uterus. Always thinking that I'm going to lose the baby, or going,
Look at the camera.
always feeling like I may lose the baby. That has been the most challenging of this pregnancy, because I have the irritable uterus, along with that was a cough. So
no, I think it's wonderful for you to talk about it because a lot of women may feel like you feel, but they're not able to really express it or verbalize it, or they might think it's just them. But you know, it is very frightening for women who have had preterm deliveries in the past,
scary.
who had friends who've lost early babies. For you to have that fear, it's a very normal fear.
Yeah.
That you know you don't so maybe you're afraid to share it with someone else or your partner. So it's good for you to share it with everyone that yes, all women have these fears. Some more than others based on their history.
Yeah. I've had it more, probably more than some others. I mean, we all have our anxieties of possibly losing our baby, especially like a person like me when I pretty much, for the most part, I know this is definitely my last baby. So I didn't want to try it again. But yeah, but the other most challenging was the pressure of the baby and not being able to walk a long distance or pretty much been on like partial bed rest pretty much the whole pregnancy, and you know, just being scared that with the baby being so far down and me having an irritable uterus always contracting, that it would change my cervix. And here it is, what, at 34 weeks last week, no, at 35 weeks I only made it to 1 centimeter. That was like a really big milestone compared to what my brain was telling me. Because my brain was telling me that, you know, all the worst things, because my body was actually doing things that could actually cause preterm labor. So
thank you, Ms. Lily. And yeah, a reminder that sometimes the brain is trying to trick us.
yes,
Sometimes the brain tries to tell us stuff that isn't based on facts.
right.
So when you look at the facts and you say, okay, I'm doing everyththing to take care of myself, going to all my appointments, doing the partial bed rest, taking my injections, you know that you're doing everything that's going to help you carry this baby to term and that everything will be okay. You'll have a beautiful, healthy baby.
Yes.
So congratulations.
Thank you.
And
I feel like I'm about to pee on myself. Let me go to the bathroom.
turn the camera off, please.
Wait. Oh wow. Look at this.
What is it?
Look how many people are viewing this.
Congratulations.
That is crazy. Hold on, let me screenshot that. Hold on. I wonder if I could do it. Let's see. Bam, did it. Hold on. Bam, did it again.
Hey, you want to do more in the future? Why do you have to pee?
It's not.
Did you not pee already?
I did, but I thought I was peeing on myself.
I know I just came to give you this injection and you're like...
It's still on. Come, let's finish talking while. I mean, I don't want to leave you waiting. I can't believe that many people are on there. What in the world? We are so excited about this.
Finally, don't announce that publicly, but
Okay.
if you can make that phone call in the next several days, this is your ID number.
Okay.
And yes, I definitely,
I cannot believe that.
yeah, we can talk between now and next week and see what you decide. If you change your mind, and at any time, you can just let me know. And in the future, if you want to do some more videos, we can do that. We can make them maybe more targeted to some other specific
We should have been
subjects.
doing this like we've been saying from day one.
Yeah, but this is a life continuum thing. You are,
It is.
not only are you still experiencing this pregnancy, and now you're going to have a newborn, there's so much you can share
Yeah.
about bringing that newborn home with mothers that possibly have never had a child before. Mothers that are frightened or scared at home that, you know, their pregnancy is going to fail. So yeah, we can definitely, and we'll make them focused on one subject that you might find most interesting or most passionate about. And I know you have a lot of different
I will.
childbirthing subjects that you are
Yeah.
very well knowledgeable about and that you can share information with too. So thank you, Miss Lily.
Thank
you for the opportunity to come
I'm
into your
probably
home.
bleeding on my butt.
Let me see. For the opportunity to come into your home every week And it'd be in your personal space.
No,
I mean, a little bit. It's not going through.
I need
But you
another
know what?
Band-Aid.
Yeah, let's just switch your
Okay.
Band-Aid.
It could be because of the aspirins too.
Yes, definitely. Definitely.
Yeah.
You're going to edit this, right?
I can.
You have to edit
I mean,
it
but we
for
didn't-
professional purposes. No.
Oh, okay.
You do. You have to make it. Okay, turn a little bit more.
So if you come, you think I should? Okay, I told you the
I don't
induction
know, we
date,
can
right?
What is your induction date?
June
No.
23rd.
Oh no, you didn't.
She
Okay.
gave it to me last Thursday.
Okay.
Remember I told you?
You told me, yeah, you did tell me she already picked an induction date.
Yep.
Yeah.
Not only did she pick the induction date, she changed my due date according to my last, well,
Ultrasound.
no, because remember I had that one miscarriage on September 30th, but when I went in for my first doctor's appointment, the lady, she said, okay, well, we're just going to round it off to October 1st. And I'm like, no, that is not when it happened. I'm like, because the bleeding started early September 30th, that morning. So how do you take it all the way to a whole nother day? So I have been telling my doctor, hey, they put the wrong due date. That is not my due date, you know. And then the midwife who came over from Winter Haven, she was there who seen me that day. And I told her, I said, listen, I don't want to go a day over. Like, I'm sick of being pregnant. And so I told her about my due date and how they just refused to change it. And then when she looked into my charts, she seen where they had me when I first came in at 12 weeks, and they had it all mixed up and messed up. So when she seen all those different discrepancies, she went ahead and did what needed to be done. And she also seen in the notes where I had also discussed, you know, hey, this is not my due date, you know?
Mm-hmm.
So she finally did it. She did it. And
Good.
after she did it, she went ahead and put my induction date in there. She also told me when I come back, if anything changes, that they'll schedule me for like next week.
Depending on your blood pressure, your
Yeah.
signs and symptoms, your weight, how the baby's doing. Yes,
Mm-hmm.
that can definitely change based on how you're doing the next few weeks.
Yeah.
And I told you, hypertension can get worse at the end.
You
of the
sure did.
pregnancy.
Yeah.
It's not to say that that's what's happening.
Mm-hmm.
Nothing else seems to indicate it, but it does seem to happen. And what I would like for you to learn and teach other women is if you've had either preeclampsia, eclampsia, high blood pressure problems in your pregnancy, is that
There's another one coming. It's growing.
you know.
It doesn't feel like it's going to get that intense. I don't know. Let's
No,
see.
this one feels milder than the other one.
Yeah.
Back to the hypertension and the preeclampsia is that after you get discharged from the hospital, after you have your baby, after you've recovered, after your baby's healthy, you're healthy, you guys stroll out of the hospital and come home. Those are still times to check your blood pressure because it sometimes can get really high even after you deliver. So the first 14 days, 2-3 weeks, the first month, check your blood pressure. Be thinking of what the symptoms are so that you can alert your doctor right away.
So you know that happened to me before.
I've met women who are scared, very scary.
Very scary. I had no idea that my blood pressure was in the 200s. I went to the doctor on the 7th day after having my baby, just to go in for my regular after follow-up. And
Postpartum follow-up.
yeah, the postpartum follow-up. And they like wouldn't let me hold the baby because they said my blood pressure was too high. The lady, she stayed in the room with me while she was holding the baby, and she was speaking to me, I guess trying to see if I was alert. and I ended up having to go to the hospital. I couldn't drive. My sister, she had to come and pick me up. I was crying because I had a newborn baby who was only seven days old, and I'm crying because I'm like, my baby got to go and stay with somebody else, and I just had it, you know. So I made it to the hospital, and they put me back in labor and delivery, and I asked the nurse, you know, because I was crying. I'm like, my baby, and she brought my baby. She let my sister bring the baby back to the hospital, and they kept my baby the whole time.
Oh, wow.
I was in the hospital for 4 days.
And where was this? What hospital?
St. Joseph Hospital in Tampa, Florida. So,
yes.
But the crazy thing is, I was like, why y'all not putting me on high blood pressure medicine? You know, not that I was complaining, because I really wasn't feeling good at that point once I found out what was actually going on with me and how serious it was. I just asked, you know, and they were like, we're not going to put you in blood pressure medicine. We're going to put you on magnesium
sulfate through your IV
to keep you from having seizures and stuff like that. I'm like, oh my God, I'm like really in bad shape right now.
Very serious. And
my legs were numb.
I'm so afraid.
I was scared
for women that go home and don't realize this could happen and do end up having a seizure at home.
Oh my gosh.
Scary. So
that is
just
so
things
scary
to know about, so that when you do have a symptom or you do have an issue, you get concerned and then you voice it to someone, your doctor, some healthcare worker, your nurse, someone that can direct you to say, okay, I'm concerned about this.
Yeah.
You need to go to the hospital.
Yeah.
Right? Because it's two things that I worry about, and one of them is fevers. A fever in a child or a very high fever in a woman. I mean, in anyone. It can be caused by, the fever can cause seizures if it's a very high fever. Then the next suspect is, do you have, hypertension? Do you have preeclampsia? Do you have eclampsia? And then that's what's causing the seizure.
Right. That is so scary. I do not want to, I ever since that happened to me, I've been, trying to prep myself, be more trying to take care of myself or whatever, because I'm going to tell you what was different.
Proactive.
Yes. Because what was different that time around, I remember my mom, she brought me home from the hospital. She brought me, to her house or whatnot. It was so many people outside. They were getting ready to go to a football game in Miami. And I'm like, oh my gosh, I got to drive all the way to Riverview with this baby. My car was on E. So I had to, I made it all the way to Riverview, and it was 301. It's a gas station that sits on the right-hand side, like next to the Winn-Dixie, and then it's like a Popeyes on the other side. And I made it there, but my stomach was cramping so bad. And I had to walk in the store, and I'm like, just keep going, because you got to get home. You need gas, you got to get home, you got this new baby. So I started out doing too much already, and that's what happened. I was doing too much. So I just learned to kind of take it easy afterwards.
Yeah. And learn about the signs and symptoms of elevated blood pressure or any other concern that you may have. Prolonged bleeding, heavy bleeding, things like that. You need to call your doctor immediately.
Yeah.
All right, thank you, my dear.
Thank you. I'm getting so sleepy. The Benadryl is kicking in. It's time to go to sleep. On Wednesdays, I sleep all day. I turn the movie on.
All for the baby.
That's it. All for the baby. But sometimes I need to go to bed because I have insomnia.
Oh, that's hard.
Let's see something. Oh, we went up. Well, thanks for watching.
Yes.
Thanks for watching.
Send it to me first. And so, I'll tell you, yeah. Don't forget to call
I am going to send it to you, too.
Don't forget to call my people.
Okay. So thank you guys for watching. Make sure you like, comment, subscribe, and share. See you later. Thanks for watching. How do you turn this thing off? You know what? See something. Nope. Don't know how that goes. Okay.